And like I saw this video and it was this color of this breed, and it's like, oh man, I wish you would research this because they're so prone to this. And they're like, what do you mean?
Welcome to The Woofy Show, the ultimate dog lover's digest. Meet your hosts, Brian and Magda, two dog lovers ready to help you be the best dog parent, unravel the mysteries of canine behavior, and keep you updated on the latest trends in the dog world. This podcast has something for everyone. Get ready for heartwarming stories, expert advice, and a lot of laughs.
Welcome everyone to today's episode. We have our first ever guest with us today. We have Kieran Metcalf, who is a veterinary assistant that we'll be speaking to, asking her some questions, things like that. So if you want to...
Yeah, well, thank you so much for being here.
Yeah, thank you for having me.
Yeah, we appreciate you coming over. And before we get into the whole episode, we want to do a little icebreaker. So the question for today is, if you were going to be a dog, what dog would you be and why?
Oh,
like what dog breed kind of
gosh.
thing?
Okay, well, I feel like I kind of have two different answers to that because
That's
I feel
fine.
like I would want to be a specific breed, but I feel like I would be something
Okay,
different.
no, that's good. Let's hear them
That's
both.
fine.
I feel like I would love to be a golden retriever.
Right.
Because they're just, I mean, like, just like the classic, like, super, like, nice with everyone, best demeanor ever.
Yeah.
Perfect size, like, great with families, like, everything, like, just that, like, iconic, like, just, like, really
They're like an iconic
great
family dog.
Yeah. Like, just that, like, well-known, like, everyone loves them dog.
Exactly.
But I feel like I'd be... I don't know. I feel like I'd be more of like a Chihuahua or something. Because like I just feel like I'm like kind of feisty.
All right.
And like
Right.
it's never really, I feel like in like unpredictable moments, which is I feel like my interpretation of Chihuahuas from working with them all the time. But they also have that like really, they can also have just like the sweetest personality.
Yeah, they're
That's
like
interesting.
small dogs with big personalities.
Small but feisty.
Like
Yes.
that.
Yeah, that's true.
But what dog would you be though?
Oh, we got to do the icebreaker
yeah,
too?
of
Oh my goodness. What's a really lazy dog? That's probably what I would be.
I would call you like a pug.
No, I think obviously I don't want to use Tolex, that's what we have, and they're too energetic. I'm not that energetic. I would probably be a dachshund.
A
Just
dachshund?
because they're just like slither around, they're really low to the ground. They always, like they're sleeping all the time. Yeah, they're just like fun little playful dogs, but then they also just like to just chill. They're not like crazy energetic. I don't know. I wasn't expecting to be thrown on the spot for this. So I don't know.
Now
That's
you
a good
were.
answer.
Well, now it's your turn. We'll see. Well, no, it's fine. You can
I would
answer.
be like a Chinese crested or something.
All right.
Because they're a very acquired taste.
Yep.
And I just think I'm a very acquired
Okay.
taste kind of person. You either like me or
No
hate me.
comment. But yeah, so that was interesting. That was a good answer, actually. I like that because that's so true. It's what we'd all want to be, but what are we really?
Yeah.
Yeah.
You're right. So, so to get started, we'll just let you kind of introduce yourself. Like, obviously, you can re-say your name if you want to. What you're like, how you became a vet assistant, and like what got you into that field, and then obviously, of course, since this is about dogs, what dogs do you have? What breed, names, how old are they? As well, throw that in there.
There's a lot of questions to throw at someone.
So just introduce yourself, what your dogs are, what dogs you currently have, and then just a bit of background story of how you became where you are now for what you do.
Perfect. Yeah. Well, I'm Kieran. I am, a vet assistant at a small animal general practice here in Calgary. I have two dogs right now. I have a duck toller, just like these guys do.
Yeah.
His name is Reese. He's 4.5. And then I have a Newfoundland who just turned 2. And her name is Juno. Hers, I like to like give a little backstory on her. Like Reese was from a breeder and chose his breed. Very specifically, like I knew I wanted one, just like you guys.
Yeah.
But with Juno, she was actually a client at my previous vet clinic. And I met her at 8 weeks old. Like she had her first puppy appointment with us. But her family ended up having like some medical situations going on where they really like could not have her in their home anymore.
Oh my gosh.
So we ended up taking her, my boyfriend and I. And yeah, we've had her for just about a year now, a year in February. So
That's awesome.
she's the
Wow.
best. So is Reese.
Yeah.
Obviously biased,
Yeah.
but
Yeah.
That's such a
they're
like
the
two
best.
different dogs, right? Two
Totally
different,
different.
energy levels too, I would assume.
Yeah, definitely. Yeah. She's an interesting newfie. She's a little bit like smaller set than
Yeah.
most. Like she's
Yeah.
quite not as large, and
Okay.
her shoulders are like more, not as broad. So she's just looks a little bit different than I feel like most do. But
Okay.
Yeah.
she's great. They're both. They do have some similar interests. They both love swimming, obviously. Like
Yes.
that's pretty much what they both were bred for. But they're very different. Like at 2, she's very calm and like is so content to just like sleep all the time. Still has
Yeah.
that puppy playfulness that Reese doesn't have, but
That's a nice age difference as well, hey? Like
really nice.
4 and 1, is it? 1, 2.
yeah, she's just turned 2. Yeah, it's super nice. It was definitely a totally different experience getting a dog as an adult, like that had
Yes.
been
Yeah.
trained and everything. So that was a cool experience to have too, because I'd never done that.
Yeah.
But
Yeah.
Reese was my first dog that I got. I got him alone, just me I had just finished my 4th year university, so I was 21.
Wow. That's
Got him on
crazy.
myself, and hers was a different experience too, because my partner was with me when we got her.
Yeah.
So
So then, obviously, we mentioned you're a vet assistant. So how did that came to be? I know you mentioned you had a couple jobs in the dog industry leading up to that. But
yeah, I did. So I'm currently a vet tech assistant, but I'm also in school to be a vet tech. So I'm about halfway through that. But I started actually in my summers. I think my 3rd summer in university, I started working at a dog daycare in Calgary. I won't mention them by name, but it was a great experience, and I worked there for 2 summers and then a full year and a half after I graduated.
okay.
And then it actually happens to be a daycare it has a vet facility on site. So I established a bit of a relationship with the vet there.
Oh, okay. Like
So
kinda-
that's how you
And
kind of
I
got into
applied for
it.
a job, with the manager through that. I gave her my resume, and I initially got a job as a receptionist, actually.
yeah.
It actually wasn't at that specific site. They have like 4 clinics in Alberta. And I got a job as a receptionist at one of the other ones at West Springs Vet, is what it's called. And then after 2 months, I got the job of vet tech assistant, and I've been doing that for about 3 years now.
Oh, nice.
So
And
That's
then
awesome.
is that when did you decide to go to school to become a vet? tech?
it's been 2 years. January was my 2 years of being in the program.
Yeah.
I would say I decided like probably only a couple months prior to that, I had actually been exploring vet school, which is still kind of a dream of mine. I'm not sure if it's a goal anymore,
Yeah.
more of like a dream.
Okay.
But
I was going to ask you actually what kind of inspired you to get into that field of
Yeah, I
working
guess
with dogs and
that's
helping
better
dogs and things like that.
yeah. So the entire time I was growing up, actually, I always said I wanted to be a vet. There was like a brief stint of me wanting to be like a chef. But other than that, I wanted to be a vet from the time I was really, really little.
Yeah.
It only changed in late high school. But I think I actually kind of happened upon the opportunity to work at a dog daycare. I had a friend that was working there, and they needed seasonal staff. And I actually couldn't find another job at the time. And that one presented itself. I was like, that is the coolest job. Yeah.
It's like everything just kind of aligned.
They were
in
super
place.
long shifts, like 10 hours, I think, if I recall correctly. But you're on your feet all the time, and you're outside, and it was like the best. You're surrounded by dogs. So
Yeah.
it was pretty ideal for me. And through that, I started to realize that I was really interested in the medical aspect of things. We used to do like full assessments of dogs as they came in to like check on how they were doing, to make sure they didn't have anything kind of underlying that we could see on first inspection. And when we did find things, or if there was anything that happened when I was working there, like I always found that so interesting. If there was anything that I could kind of dip my toe into that was more medical related, I found that I was really happy doing that.
Yeah.
So I think I just decided that I was at a point where I wanted to shift into more of like a career aspect
Yeah,
of my
that's
my
awesome.
life than job. So I went for it.
Yeah. So actually, I have a question. I'm sure a lot of viewers will be the ones that are thinking about getting a puppy. They will be thinking about, how do I choose the vet clinic for me? Like, where do I begin?
Yeah. I think it can be a bit of a daunting process for sure, especially if you've never had a pet of your own. Like if you're like that first time pet owner, I think it can be really daunting. Or if you're moving to a new city and you don't really know much about where you're going to go.
Those were us, so
Yeah.
We moved from England, and then we were like, oh, want to get a dog, but now there's all these things that we have to do as well, like find the clinic and stuff. So I'm just wondering from like your perspective, like what steps or like what things a pet parent should think about when choosing the right clinic for them.
Yeah, I think it's obviously dependent on circumstance. Like I think that, if you're someone who, money isn't as much of an option, I think it's great to kind of look all over the city, look at all your like all the reviews, even reach out to multiple clinics, and ask as many questions as you have.
Yeah.
Like that's never something that a vet staff member will ever be upset about. Like it's something, or they shouldn't be, I guess, is what I should say. Because it's our job to provide you with the most information that we possibly can, and try to make you feel at ease. Because just as much as the patient is important in relationships, so is the client, like equally so. And I would say like, even if, you have a sort of like conversation with a clinic, you think it's going to go really well, and maybe it just wasn't the vibe that you were looking for in that first appointment, there is no shame in looking elsewhere. Like it is about having a team that you trust through and through. And I think if there's specific things that you're looking for, that's really important as well. I mean, like if you're a family that has multiple different kinds of pets, like if you have exotics, like small animals, birds, reptiles, things like that. There's some clinics that actually offer all services. Oh. So I think it's depending on what you need, what you're looking for. I think my number one piece of advice though would be, don't necessarily isolate to your specific community. Yeah. Because you're gonna find some incredible vets all around the city. Yeah. And I'm not saying that wouldn't be the one right next to you, but definitely look into it. Look at those reviews, see what the patients say. And if there are negative reviews, look at what the context is of that situation, right? Because sometimes it's like, oh, this vet wasn't open Saturdays. Yeah. 1 star. Yeah. It's like, that's actually really affecting, that's really affecting the rating of a small business if it's like a locally owned business that just opened, right? So.
Yeah, we understand that. When we were searching for the vet, we actually went to a couple places because like number one thing that was important for us was that the vet was comfortable with like the raw diet. Yeah. So that was like a thing for us, right?
So situational, like you said, like depending on
what your needs are. Yeah. The things that you, there's so many aspects of, it can actually be really difficult to find a vet who's supportive of raw feeding. So I totally understand where you guys are coming from with that.
I guess our selection isn't very big for that. So I guess it made it easier. There was only like a handful to be honest.
But like if someone doesn't have that one aspect that they're really looking for, it'd be kind of overwhelming, right? Like there's so many vets, like which one do I choose? Yeah. So I guess the thing is to just shop around and don't stick to one place.
So the next thing we want to know is, how do vet clinics ensure that like pets have a positive experience? So when they go to visit.
Yeah, I mean, I think every clinic is different. I think that many clinics use different tools, but I won't say that we can ever guarantee that they have a good experience, which is probably not what everyone wants to hear, but we definitely do our best. There's a lot of things about vet clinics that are just like, as soon as a pet walks in the door, it's something that has them a little bit offset. Like it's pretty common for them to have like a fear, anxiety, or a stress response, just because, the smells, seeing other pets right as they walk in the door, pheromones, even like noises. So there's so many things that just affect the experience as soon as you walk in the door. So I think it's trying to combat those things.
So how do you combat those things?
Yeah. So I think that it's about the vet staff just being on it. So I think, like, for example, like if you have a pet that's reactive, like on leash, I think it's really important that there's notes made everywhere in that record so that we can make it the most positive experience. So they're not walking into a clinic where there's a cat right there or another dog right there where they're immediately going to be having a response.
In that state of mind.
So it's about knowing the pet, even if you like, and if they're a new client, asking prior and having those medical records prior, and knowing the things that, as much as you possibly can, what to expect. There's no one dog that's better than the other. There's nothing wrong with having a reactive dog. It's so common, and they're the loveliest, sweetest dogs. It's just, different dogs need different things. Different cats need different things. Those are the only animals that I have experience with, so the only ones I can touch on. But once they're actually in the clinic, there's definitely a ton of things that we do to try to make it more positive. I can only speak from, what my clinic does, so I'll touch on that. But food is a really big one for us. We really hope that when patients come in that they're really food motivated, because it is such a positive reinforcement tool that we use all day, every day. It is so important. And it makes the experience so much better. It's just night and day. Yeah. But obviously that's not always the case. We try a bunch of different things.
Yeah, just
that work
feed the
with
dog all the time. Be happy.
Feeding treats, feeding wet food, lick mats. We use all of those tools. We even fill Kongs sometimes. And you have to have a bunch of different varieties of food options depending on allergies, things like that. But also, we utilize toys as well if that's something that's motivating to the dog. And also, if it's just actually like physical touch. Anything that's beneficial to them. I also tend to find that I would say that most dogs tend to do better with their owners around. That's not a total overarching theme, but trying to do the most things in the treatment room that you can, or sorry, not in the treatment room, in the exam room. Yeah. So you're not having to take them back and forth, because that does increase that fear, anxiety, stress response as well. And you're just wanting to make it the absolute easiest that you possibly can on that patient. So even just having the vet go into the room, and having everything with them so that they're not coming in and out. There's not noises. There's not new smells coming in and out with the vet. As much as you can. Yeah. Obviously, sometimes we need to get things, but.
So is there anything that dog parents can do prior to visiting the clinic to kind of make the experience less stressful for them? Or is there nothing really? You just kind of turn up and be like, I hope for the best.
For sure there is. No, absolutely. I would say there's a couple things. One, I always recommend to people before they come to a clinic for an actual appointment is bringing them in for a meet and greet. A lot of clinics offer that, and it's usually complimentary, and it introduces them to that setting without any sort of aversive stimulation. As much as
just
you can.
Say hello to everyone, right?
Yeah, and feeding them treats, having just having them meet the people that they might see, smelling that smell, not associating it with something bad, hopefully, obviously. That's a huge one for me. I recommend that for anyone, whether your dog is 13 or an 8-week-old puppy. It's super great to have them exposed to that environment in a positive way the first time.
We sometimes just visit the clinic to have a step on the scales.
So
that's a really great tool too. I was going to touch on. So happy visits. Yeah, we do that. We do that frequently, especially with dogs that are overly anxious, and we're trying to get them exposed to that environment as well. But if a dog is perfectly fine with a vet, totally bring them for happy visits too. There's no harm that's going to come from that. And getting them on the scale, more comfortable with that is great too. So that. I would also say sometimes, and I think that this can be a topic that's a little bit taboo sometimes, but I do think that it's really important to listen to your veterinary professionals if they recommend pre-meds for appointments.
Okay.
So if a pet is really, really stressed out, and this will be kind of talked about later because there's something else we're going to talk about, which is the fear-free medicine. Yeah. But I think it's just sometimes we just don't want to push it. Yeah. Right.
So what are the pre-meds specifically? For those that don't know what they are, how would you explain it?
Yeah, so sometimes they can be nutraceuticals, it can be a prescribed herbal medicine,
right?
Or a supplement, something that's just a calming calming supplement.
Like
But
lavender based or CBD based or
It's typically- it
things
typically
like that,
wouldn't
or
be-
chamomile, things like that.
chamomile can be for sure.
Yeah.
But I think that typically like we carry specific nutraceuticals just in like a capsule form.
Yeah. Like a
They're like pretty much made of different herbs.
Yeah.
There's also like I actually used to work with a herbal medicine vet, and she does up tinctures as well, for like just leading up to stressful events. There's a bunch of different components to that, and I would
Yeah.
not be the one
Yeah, that's fine.
to explain the pros and cons of those things. But I think it's just about talking to your team if nutraceuticals is what you would prefer for sure, like more natural. There's also pheromones, so you can pick up pheromone sprays or like collars. You can spray it on like a bandana or on their own collar.
I didn't actually know those exist.
Yeah,
No.
and so that can be a really helpful tool as well. Just depending, but sometimes it is like actual medications that are necessary. And it varies patient to patient.
Yeah.
That's definitely something that a vet could touch on more for sure. Different vets have different protocols as well, but they can be really, really helpful. And we're not talking like full on like under anesthesia
Yes,
type.
sedate
It'll
your
be
dog.
like it's typically there's like a few different
Like
medications
tools,
that are used.
right?
Well, knowing there's options. So, we
Yeah.
didn't know. I mean, luckily we don't have that problem, but we
Yeah.
didn't know that was an option.
Yeah,
and there might
yeah,
be
but
people who
definitely
do.
like when I think sometimes when it comes up, people are a little bit, not super into it.
Yeah,
Like
hesitant.
upon first-
Open-minded
Right,
about it,
upon
right?
upon first suggestion
Yeah.
for sure, and that's totally fine. Like if you're not first time, I would urge people to like sit with it, think about it,
Yeah.
because it's never going to be recommended if it's not something that we really think that your
Yes.
pet would benefit from.
Yeah, definitely.
So, yeah, and they tend to be not overly pricey as well, like, which is great.
Yeah.
So that's
So
like a
is
nice.
there anything else that a dog parent could do before visiting the clinic to make the experience
I would
less
say
stressful?
actually it's really helpful if they come in hungry.
Oh, really?
Yeah.
Oh,
That's
Okay.
something
We
that I've
always
learned
feed
recently.
her. Maybe we shouldn't.
well, no, we feed her at a normal time, but I guess we always do vet visits in the morning, so it's shortly after she eats. So
Yeah.
okay,
But that's
Not
interesting.
not like starving, like don't like just not feed a meal,
Yeah.
but
Yeah.
like a little bit hungry is great
Okay.
because I find that
Then they're like more motivated to like get the treats from you guys
Right,
and
right.
be happy there. Cool.
yeah, so that's a nice one.
Would you recommend like walking your dog before going? Like,
Like,
I think totally if your
Exercising
dog has like
them.
a lot of energy,
yeah.
absolutely.
Yeah,
for
for
sure.
sure.
Just to keep them, like it's so great to have them stimulated prior to coming in because there's like I said, there's so many things that go on
Yeah.
in their mind and in their
it's like
body when they
training.
walk
They
in.
say
So.
don't when you want to do training sessions with your dog, burn off some energy first.
Right.
So
yeah.
then that's
Then
out of
in
their
that-
system. So
yeah.
similar thing, to get
Yeah.
them to sit still so they can be checked, and if they're like really full of energy, I get it.
Yeah.
So that's a good thing to lead into the next thing we want to learn about is the fear-free clinics. And so what are those, and what makes them different from, say, a normal clinic, whatever a normal clinic is, I guess.
Yeah. Like just give us like a comparison between the two, maybe.
Yeah. So I would say, so there's definitely, so I should note too, I am a fear-free certified veterinary professional. So that's super exciting and
Yeah.
newly certified. So
Congrats.
definitely, thank you. It's definitely, it's a really, it's a really great tool to have. I think that there's been like quite a shift in veterinary medicine in the recent years, from what I've seen at least, especially with like new veterinary graduates and whatnot, like shifting into a more fear-free mindset. And there's a lot of things that kind of,
So what is the fear-free clinic?
yeah, so pretty much it's trying to create the most positive situation for a patient and client as possible, but priority is the patient pretty much in this sort of like noticing their fear, anxiety, stress response are the main things. And so a huge part of that is dog behavior. So being able to recognize and cat behavior, like sort of what they're telling you with their body language, what they're telling you with any vocalizations. just with anything that they're doing and trying to cater to that pet.
Okay.
And actually,
So it's a more custom way of looking after the patient in that case.
right. So it's moving away from kind of like pushing your way through a procedure, like to get it done, and trying to figure out the way that it's most comfortable for that pet. So sometimes it actually requires the pet to come back on
so-
medications,
So
right?
like
So
if a pet is under so much stress that it can't be worked on,
Then
you
then
will
you
just
stop.
send them back
Right.
and be
So
like,
there's an example for that, actually, I think. So I'll say the example of what I experienced and see if that's what it is. So I think I took Maple to a vet once, and they have to do the temperature check. You
Yes.
know? And she was not having it.
Yeah.
The thermometer thingy. So
because it had to go up her butt.
yeah,
Yes.
it did.
Yeah.
So she was not having it. So they did. They found like another way to do it.
yeah,
You know, and obviously they tried a couple times, and she was just like, wiggling away, and even I tried holding her and all of that. But then they were like, okay, well that's not going to work, so like let's stop, kind of thing, and let's instead of like
And
you said, and
adjust the
just like
plan.
we're gonna tie her down and shove that, you know. So yeah, I guess it happens without us realizing it happens, and now that you put like a label, a sense on it, it makes sense, and it's like really good. I never thought about it that way. I
Yeah.
thought that was just normal, but I guess it's not.
yeah. I mean, which by no means I'm not saying that every vet
Yeah.
does that. That isn't like a fear-free certified
Yeah.
vet or tech or assistant or receptionist. By no means. I think a lot of people practice that without being certified.
Okay.
Yeah.
It's because I mean we always have the pet's best interest.
Yes, of course.
At heart. So
I wonder if that's a little bit frustrating for like a pet parent because they're like, oh my God, I have to go back now. And it's just like so annoying. I'm going to have to take some time off work.
yeah, for sure. So sometimes we get met with that. Yeah,
Yeah.
just kind of like, can you not just do it? Like, can
Yeah.
you not just like get it done? And I think, yeah, with fear-free vets that I've worked with, they're just very headstrong and no, like,
We can't do it.
And
like
if-
your
if-
pet is not comfortable.
right, like, and just like I won't do it.
Yeah.
Yeah.
Which, yeah, I think is respectable.
I wonder if there's any difference in terms of like the clinic layout, for instance, when it comes to like fear-free clinics, right? Like, I assume you don't just shove them in a kennel and, you know, you're away from the owners and they just being worked on in isolation. It's more of a social experience, I would assume, in a fear-free. So there's no tables, like for instance in our
Well, I think
clinic, right?
that's the what did you call it? What's the first room they go into? You had the word for it.
Examination.
Yeah, you have
Yeah.
reception area, exam room, treatment room.
Okay.
Surgery.
Yeah.
So I think the exam rooms are mostly like that, but not the treatment rooms are usually.
Yeah, I would say most treatment rooms are pretty similar. Definitely all of them have kennels for sure.
Yeah.
Yeah.
But definitely different patients require different things. Like
Yeah.
I've helped recover patients multiple times not in a kennel. If it's not in the cards for them, it's not in the cards for them.
Yeah.
And that's totally fine. You just have to be
Because we were told that the exam room used to have tables that you would put your dog on top,
Yes.
which made it a little bit more like dogs would be a lot more anxious about that rather than just having them on the ground
Yeah.
and examining them
Yeah.
like
Well,
that.
because they're also not
right?
used to being on tables, because
Right.
obviously no one
Yeah.
wants their dog climbing on tables and counters. and
Yeah.
stuff.
Yeah.
So that was just our experience. So and it's something you didn't think about, and it's like, oh yeah, I guess that makes sense.
Yeah, for sure. I think it's also, exam tables are definitely a really useful tool sometimes,
Yes.
especially with cats. It's something that's actually very, very useful with cats, even like putting them up on the table in their crate prior, like kind
Yeah.
of with like a pheromone towel over their kennel, so that they're used to being up there. They also just like to be up on higher places. Sometimes they would rather be held in a lap. Sometimes they'd rather be on the
Yeah.
ground. It's
Yeah.
just definitely pet dependent. Yeah, it's the same. Obviously, like you would never want to put like a Great Dane up on a table,
yes, of
but
course.
definitely, yeah. It really is about watching an animal's behavior, testing out things to see if they're showing any sort of response and trying to adapt to that. That's pretty much what.
So
Jeffrey
is
is.
that, I guess, something that like new pet owners or something, or people that are looking for vets, should they be looking for that? I would assume so.
I think
but
if that's something that is really important to you, yes. Yeah, I think it's about doing your research into that. And actually, Fear Free has their website is really great. You can actually go right on and look in your area and you can just look like Calgary, Alberta.
Yeah.
It'll come up with every Fear Free person and where they work.
Oh, wow.
Oh,
Yeah.
I'm curious now. We have to look it
Yeah.
up.
So
I don't know if I
yeah,
want to know.
yeah, yeah. So yeah, you can do that. But yeah, again, like I said, so the practice that I work at currently, it's amazing. But I am the only person who's fear-free certified.
Okay.
But we use fear-free medicine as much as we possibly can. Like I would say it's, like 99% of the time.
So is that like what somebody would ask? Be like, oh, is this vet clinic fear-free? But like, how would somebody
I've had a
ask
couple
that
people
question?
ask that. Yeah, like because it's not an offensive question.
Well, yeah, like
it's just
a direct kind of.
Yeah, and just I mean
Are
we're
you
not
gonna
a
force
certified
my
practice,
dog?
but yeah, and so the thing is too. So clinics can become like a fear-free certified clinic itself, like the practice.
Okay.
There's actually not. I don't think there's a ton of them in Calgary. But again, like an individual in that clinic can be fear-free certified. So yeah, you can always call and say, do you have a fear-free certified vet? If that's something that you're looking for. So, or tech or TA or whatever.
Yeah, that's interesting.
Yeah.
Yeah. Well, so what are like the most common concerns or questions that dog parents come to you when they first sign up with their pet?
I would say, frequently pricing for sure.
Yeah.
That's the no-brainer.
So like, I wonder, like, are all vets like similar in pricing, or are they more expensive ones? And
there is a range for
There
sure.
is?
Yeah.
Okay.
Yeah. So
there's no regulation in terms of pricing in the vet industry.
I actually don't know the answer to that question.
Okay.
I think that there might be some sort of like outline
Yeah.
because I know there is for like wages. So I would assume that there would be for pricing.
Yeah.
But again, it's that business's decision.
Yeah.
So yeah, definitely search around. What I will say though is cheaper doesn't always mean higher quality of care.
Well, yeah.
So definitely just, do your due diligence there. If you see any, you can always ask for estimates from a lot of places too, just to see like if it's like a surgery you're looking for, or just a vaccine appointment, but, and look at the differences and see what might be missing from other ones and ask questions, about whether or not that thing should have been in that estimate. Because sometimes, we see, I'll give you an example. Dental surgeries are a very, very, very common procedure.
And expensive.
Very expensive.
Yeah, we've heard.
Yeah.
Just heard.
Yeah. So, I mean, actually, if you're super on top of it early on and you're getting cleanings done, I'm not, obviously there's things that are uncontrollable, like just genetic things. But if you're pretty on top of it, getting cleanings, it's not the most unmanageable expense.
Yeah.
Hell yeah.
I mean, you can give us like a
Like
bracket
human
or
dentists
something.
are not cheap either. So I think we do understand that.
Yeah, for sure. So
And dental's not covered by insurance, right?
it depends on the company.
Oh, okay.
Oh,
Yeah,
okay.
it does. It does depend on the company. I believe Trupanion covers some dental.
Yeah.
Yeah, others not so much from my experience, but I think it's also case dependent too.
Right. So what are any other concerns or like things that people come to you before they sign up with you
Honestly,
guys?
we have people ask many questions. A lot of people ask, are you experienced with this specific breed? Like, do you have a vet that is
Oh.
Okay.
like really is really experienced with Great Danes? And you're like, well,
Yeah.
sometimes like I used to work with a vet who had 4 Great Danes, and we'd be like, yep, and we just book them with her. But
So like not all dogs are the same, I guess.
they're not for sure. But I also think, I would definitely recommend being open-minded because vets are very, very qualified individuals.
Yeah.
And
Just because they don't have experience.
just because
with
they
this
don't have a breed or
it
haven't
doesn't
had
mean
like
they can't
30
work.
patients
Yeah.
of that breed, especially if it's like a breed that's not overly common.
Yeah.
It doesn't mean that they don't know what they're doing. So,
Yeah.
but it's definitely a fair question to ask if that's something that's important
okay.
to you. So,
Yeah.
Yeah.
so we have that question. I've had people ask if our practices are fear-free or if we have a fear-free professional as well. Yeah, I don't, just kind of like process of vaccinations as well. Kind of like
Like the timings of it.
timings.
and-
Timing, what we recommend at appointments.
Yes. Okay.
Things like that, because we'll always recommend it if it's a puppy or if it's like an annual and vaccine appointment. We'll always recommend parasite preventatives, things like that. I would say that most commonly the question prior to somebody coming in is mostly price.
Yeah.
Fair enough. I mean, yeah.
Yeah.
People realize pets are expensive after they get them. So.
Yeah.
Yes.
Okay. Actually, yeah, I have something to touch on
Oh,
that.
okay. That wasn't even a question. That was just a statement.
Yeah. So what I will say is not that like, I just think it's super important to do your research into your breed
Yes.
before you get a pet. And I cannot reiterate that enough.
Yes.
And I guess if you get a dog from the breeder, they will kind of push you to like, you really need to watch this video, that video.
yeah,
You need
depending
to
on
know all of these things, right? For instance, of that dog tollers. Like,
Okay, dog
right?
toller breeders are a different breed.
Yeah.
Like they are like, here are the 50 links that you
Yeah.
need to look at, and these are the things that we recommend.
Well, and this is how much money you're going to expect to
for
spend
this,
in the
this,
first
this,
year.
it's crazy.
Yeah, we had that list, and
Yeah.
we were just like,
It's like, are we
but
ready
we knew.
for that?
We knew,
Yeah.
though, and I guess that's, like you
But
said,
it
that's what
set your expectations then, right?
people don't do, I guess, is what you're trying to say.
Yeah. I think often people, I mean, I think that this is something that most people know, but I just think many people are just really, they become more like infatuated with what a breed looks like.
Like aesthetics of it.
Right, aesthetics, or if they're like hypoallergenic.
Yeah.
Which I won't touch on that,
Yeah.
but
Yeah, no, yeah.
yeah, but again, like I think, and that's totally fine. Like if you're someone who's like, I want a French bulldog, and
Yeah.
that's what you want, and like you know what that comes with.
Yeah.
That's
Yeah.
I'm never.
But I
gonna
think
be
people that
someone
are
who-
that like set in this is what they want, they are usually the people that do the research.
Right.
So that's
Yeah.
the thing. Like we were set when we wanted a toller, and so it was like
Same, yeah.
articles and
We did like so much
yeah,
research.
and so you kind of know, but there are people that don't know. They're just like, I want a cute dog for my kids to have growing up.
And like I saw this video, and it was this color of this breed,
Yeah.
and it's like, oh man, I wish you would research this because they're so prone to this,
Yeah.
this, and they're like, what do you mean?
yeah. And also you have to go to groomers and have to
Right.
groom
Depending
them
on the
every
dog.
week.
Grooming,
and-
huge
Yeah.
thing that people underestimate. Even double coated breeds, like even just the bath and tidies.
yeah.
And the like, I mean, yeah, like the debulking treatments and stuff when they're really shedding too. Those are so helpful, and I think a lot of people don't even know that exists. So
yeah.
it's definitely
Do your research. That's the lesson for today.
yeah, do your research for sure. And also like, yeah, I mean, I love, like, I'll just do a little plug here for rescue too, because they're just like, there's so many animals that need homes too.
Yeah.
It's perfectly fine if you have a breed that you want. But yeah, if you don't, I would totally urge you to look and see what's out there, because there's so many different, like small to incredibly large, giant breeds,
Yeah.
right?
Yeah.
So,
Yeah, shelters are very diverse
Yeah.
in terms of
sure.
everything, but it's also important to like understanding what you're getting, right?
Right.
Too.
And I guess people don't, and that's why they get so surprised when they go to the vet. And it's like, well, if you knew these things, then this wouldn't be as much of a shock. Like,
Right.
not saying that
Yeah.
these conditions will happen, but at least you're prepared for them. to
Right,
happen.
right. So yeah, like tollers, right? Like tollers are prone to like Addison's disease.
Yeah.
Yeah, and like the hip dysplasia.
Hip dysplasia,
and-
yeah, like oral health, like just poor dental health.
Yeah.
Yeah.
Like
And
things
I
like
think they
that.
have very sensitive eyes, which can cause problems too.
Right.
Some
So
of them.
just knowing that and going into appointment, like it's nice to just know those things,
Yeah.
so that if those things happen, if you get like an Addison's diagnosis for your toller, like it's just, at least you kind of
you were prepared with that. Yeah.
kind of knew.
You
Yeah.
just kind of
You knew what you were signing up
Yeah.
for in the risk that you were taking. So
That's huge, actually. Yeah, I guess that's something I don't really think
But
about. with
also you
people.
can take preventative measures, right? For that
sure, yeah.
certain breed.
yeah,
so that
definitely
it
for
doesn't-
certain things, for sure. Yeah.
Yeah.
Well, genetically it can still happen, but if you take some type of precautions early on, then maybe the chances of it are lower.
Yeah, for sure. Even like
Potentially.
allergy
Yeah.
Yeah.
dogs that are prone, like specific breeds that are prone to allergies, or breeds and coats.
Mm-hmm.
Like even I find, I don't know if this is actually a statistic, but I find that a lot of like the blue colored French bulldogs have allergies. Like I just
really?
feel like that's just something that I've noticed.
Okay.
Yeah. That's
So
interesting.
I don't actually, I don't have any factual backup
No,
on
that's
that,
fine.
but
We've said a
that's
lot of things.
definitely
That we've
something
said.
that
It's
I-
just our opinion. This is no.
it's definitely something that I've noticed. And I think like if you know that in advance, then you can catch it
Yeah.
early on. You
Yeah.
notice those signs, you notice those ear infections, the licking at the paws, the redness, the itchiness, the dry skin. You can combat that
Yeah.
pretty quickly. So
That's interesting, actually, because we did have a Frenchie in our puppy group, and she had massive allergies on her paws. She was allergic to grass.
Oh yeah, that's right.
Yeah, environmental
Yeah.
allergies.
I
Yeah.
remember that. Yeah, when we had like a
I'm
little
like, oh my
outdoor
gosh.
session for like the first 20 minutes of it. Yeah.
Yeah, that was so sad.
Oh yeah, I remember. Yeah, they were all like red and
Yeah,
swollen, and yeah. Yeah, so obviously we kind of talked about what are the common things that people ask for vets, but for your experience specifically, what is like the strangest or weirdest like request or question that someone has
Or like
had,
a problem.
or just like that's just completely out there and not normal,
Ugh, I don't.
if there is any, of course.
Yeah, I mean, it does happen a lot. Yeah, I can touch on that a little bit. I think that I'm not really sure why, but I think that it's like quite a common theme for people to be quite, I don't know what word I should use here, like just off with their vet staff, like kind of like mistreat them a little bit.
Okay.
Oh,
So,
really?
Yeah, I would urge people to be a little bit kinder to their vet staff.
You
Say
know
that
what?
a little
So I
bit closer
think-
into
I
the
think
microphone.
The problem for that though is like people get very emotional if something happens to their dog,
For
and
sure.
so they're just like they're not thinking straight, and they're like
Yeah.
whether they're really stressed or
Totally.
worried or upset, and it is a shame that they take it
Oh,
on the
totally.
vet staff. But I just feel like it's a very like hard moment sometimes.
Oh, it's
for
so
people,
hard. It would be
so-
like going to the pediatrician and being
Yeah.
told something about your kid.
yeah, I guess
Yeah.
yeah.
I mean, we're in that wave where, like that time period where, I mean, people are treating their dogs as if they're kids.
Yeah.
And I treat my dogs
Yeah.
like they're my
Yeah,
kids,
that's- we do.
right?
they as
Like
well.
it's
Oh,
they
yeah.
are.
Yeah.
They're your dependent, right?
Yeah.
So I mean,
Yeah.
yeah,
No,
but
we should have on a tax write-offs,
Yeah,
right?
well.
Dependent, my dog.
yeah, and totally like if it's a scenario where there's something going on with your pet, like there is no more empathy than like you will not get any like more empathy than you get from a good vet
Yeah.
staff member for sure. But I like it's just like the little things sometimes that you're just like this is just not a big deal.
Yeah.
Yeah.
You know,
But
like
do you
I
have
had
like a story.
Oh
that-
yeah, I had a there was a client at the practice I used to work at who he was 30 minutes late for his appointment at the very end of the day. It was the last appointment of the day, and we were closing like 2 minutes from then. And we had called him and we told him, you know, like
Yeah.
we have to reschedule your appointment. It was actually the second time that he showed up late, like very, very late. And like there's just nothing you can do at that point, right? Like you
Yeah.
can't.
We closing.
can't
we
do
gotta
anything.
go home. We've
Yeah,
got
so-
lives too.
And we told him, yeah, like we're gonna have to reschedule. He was pretty upset about that, and he ended up showing up anyway. And it was, yeah, I think it was like 4:58, and we closed at 5. And the receptionist was just standing there, and she was like, "No, I'm sorry, like we can't. Like there's just
Yeah.
like our vets had actually left the building. Like it was just everyone else left cleaning. So
Yeah.
we're like, there's actually really nothing we can do." And then he, like his dog had an ear infection, I remember. And he was like, "Oh, well, okay, like what can I do in the meantime?" And so the receptionist had brought down a couple of like, just like ear cleaning options. And she
Yeah.
was like, if you're
Yeah.
gonna, like, it's not definitely what we recommend if you're coming in for like an ear appointment, but
Yeah.
I think she just wanted to give him something. And he picked one up and he threw it at her.
Wow.
Oh my god.
And he like swore at her and walked out. And she, like, and I was just like, that's insane. Like that's a
Like,
frontline staff member who
yeah.
did nothing, right?
Yeah.
So that like that's the scenario I'm talking
Okay,
about,
yeah.
right? Like not like if there is something going on with your pet, like yeah, we totally get
Yeah.
you know taking it out on us. That's part of our job, kind of a little
Well, it's
bit in a way.
more of like, hey, I haven't heard from you in 15 minutes. Like, is everything okay?
Yeah,
It's like,
yeah.
like don't worry. We
Yeah,
know
yeah.
your dog's there. Like, don't worry.
Yeah.
Normally,
So-
that's what it is. At least that
But
I've seen. when we do.
I can definitely relate to like dog parents being like overly panicky over
For
like,
sure.
But that's
little
not panicky.
things.
That's just pure.
No,
aggression.
that was just- yeah,
that
that's
was
just
pure
not-
yeah,
rudeness.
yeah, that's just
Yeah,
someone being
exactly.
rude.
But panicky for sure. I remember the first time Reese got sick, I took him to an emergency hospital and I was like, he is bloating. Like he has GDV. Like his stomach is flipping. I know it.
Yeah.
And they were like, I think you just ate something bad.
Yeah.
Do you want us to do a pancreatitis test? I was like, yes, absolutely. Do the test. There's something wrong. They were like, he's fine. Like
Wow.
he's fine. He just
He's
ate something
absolutely
bad.
fine.
That's
yeah.
so funny.
Yeah. So I was like, well, whatever.
But yeah.
And that was when I worked at a daycare too, so I didn't really know.
Yeah.
And I just was like, oh my gosh. So yeah, for sure. And yeah, it's definitely common to just be a little bit more, snappy or
Yeah.
yeah, that's totally fine. But
Yeah. Like
Yeah.
I know when
That's
Maple
why I
had-
go to the vet and
Yeah.
she stays home because
because
she's
I'm way
just
too
too
emotional.
emotional.
I will be there emailing the vet like I need this and this.
Just yeah. So I know where I've a little bit more of like, okay, you know what? We're here now. Like this is the best place she can be. She hurt her leg and she's fine. It was just like a sprain, but she's like she's limping and I don't know what to do. And oh
yeah,
my
I
God, will she be able
cried.
to walk again? And it was just like, yeah, she just had a sprain, and that's what they said. And it was just like just let her rest for a few days. It's
Yeah.
fine. She just jumped and landed funny, and I was like, okay, thanks. You know, like.
No, but like things can happen. Like
Yeah,
she
I
might
guess.
need a surgery on her hips. You know,
You never
hip
know.
dyslexia.
But yeah. Coulda torn her
No, he did.
cruciate. You never
her
know.
brother had that, or sister,
Yeah.
yeah, her brother he hurt himself. They were like not even a year. Yeah, and he was like full on. Yeah, had like an operation. He was like crate and like kennel bound for like weeks because he couldn't do anything. So I guess
Yeah.
Fair enough.
After hearing that story,
Yeah,
and then
that's
she
true.
did that,
And
and
that's
I
it.
was like, oh my God, like not
It's
another
happening to
one.
us.
Yeah, exactly.
Yeah, for sure.
But it is true. I guess, yeah, like you said, it's just, once you get to the vet, that's the best place you can be.
Yeah.
Just let you. guys
Absolutely.
do the
Also,
vet.
if you ever have any questions, you can always email or call your vet staff. Like,
Yeah.
that's such an important thing to know. Like, it's never a dumb question.
That's true. We
So-
did. We called our vet originally. Yeah, it was when we had the little parvo scare thing. And then they're like, well, we don't have any tests in-house. Just like find the closest place to you just to go kind of right away. And they were very, very helpful. And then they're like, they'll let us know, what the test came back of. And because we didn't know what to do.
Yeah.
And I didn't want to know if I should bring her and all of that. Because like I said, we were new. And
Yeah.
so having that as an option
Yeah.
is
Yeah.
really good.
Like, totally. Like, half of our job is trying to, like, help clients through difficult times, processes, anxious
So-
moments. So,
Would you be able to share any like common emergencies and maybe how someone can deal with that? Like
emergencies.
how-
I'm actually probably not the person to touch on emergencies. Like, I've
Oh,
never,
okay. No,
I've
that's
never,
fine.
I've never really worked in an emergency practice.
Yeah.
Not
Okay.
even like a locum shift. So,
No,
I mean, I
that's
see
fine.
things happen for sure. Like our patients sometimes when there's an emergency, we're the closest clinic, they bring them to us. But those are things that I always, choking. I don't have a
Okay.
No,
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 that's
I don't-
fine.
I
We
don't
don't want you
have
to
a
give any advice. if you
solution
don't
for
know.
that.
That's fine.
had some. Yeah, choking is a really, really
Yeah.
scary one.
Yeah.
Yeah,
It's
I
really,
know.
really scary. So, a vet could definitely touch on that. But
No, that's cool.
I'm trying to think of another emergency though that I could kind of chat about. I could kind of touch on the bloating that I was talking about,
Yeah.
GDV
Okay,
a little
yeah.
bit.
Because that's really scary. Like
Super
the dog
scary,
can
and it
actually die
progresses
from
really,
that.
really, really quickly.
Yeah.
So,
Does it happen when a dog eats too fast?
there's
or-
there's so many things that can cause it,
Mm-hmm.
and it's like it can be your dog is exercising and they eat right after, or they like pound water right after.
Yeah.
It can be quite a few things. Like sometimes we don't even know what caused it.
Mm.
It could even be like your dog. Like if you have a deep chested dog, like a giant breed, they're far more prone to having GDV and bloat. So there's actually surgeries you can do
Mm.
called gastropexies, where they attack the stomach
Mm-hmm.
to the abdominal wall, so that the risk of them having that decreases. So my Newfie, actually, I gave her that. I didn't give her that surgery. I didn't perform that, but I did get her to have that surgery at FenVet downtown. They're really great. Yeah, bloat. My number one tip is to get to a vet right away. There's nothing that you can do yourself.
Yeah.
It's like you gotta get there as quickly.
Yeah.
Well, but like you said, there's preventative measures like we were talking about earlier. So
Yeah,
that
so
was
that's
a
a
normal
good one.
thing that happened. So there's a perfect example of if you have a
Yeah.
breed that then there's something.
Yeah,
you
like
can do.
I think Great Danes are a really big one for that. It's
And
really
they're-
common for vets to recommend gastropexies for them.
Yeah.
Giant breeds.
Weimaranas?
Weimaraners.
Weimaranas, those ones.
They
I
do
think
a
they're
bit of a
also
deep chest.
prone
Yeah.
to that too. We were looking after one and they told us not to exercise them after eating because they're prone to like bloated
I
stomach
remember.
and
That
stuff.
was very early. That dog. I remember.
Yeah.
That dog.
Yeah, but I feel like
Okay.
that's one I can touch on a little bit. But
Yeah.
Sure. So one last question that we have, if there's any like new advancements in that industry, how do pet parents get informed about that? For instance,
If at all.
if at all, right? Like if there's something like a new pill for this or a new pill for that, or if there's a advanced way of spaying your dog, for instance, how are people informed about these new developments in
I think
vet
it's
industry?
I think it's about your vet team keeping up to date on those things. I think typically if it's a medication, it's usually a case by case basis, right? So if your pet is struggling with something that medication would help, then that would be proposed.
Yeah. I wonder if vets have some type of, like, for instance, newsletters that they send out to their
I think some do.
clients and
I
things
think
like
some
that
do.
to, like, keep them informed about, oh, this is like new things that are going on.
Yeah, I mean, I think my past clinic had talked about doing that for a little bit. I don't know where they ever got on that, but yeah, I think definitely it's really important for your vet staff to be keeping up on recent news, recent advancements, and letting you know, like, when so for example, there's a new medication called Librela. It's being used for arthritis in dog patients. And prior, it's an injectable medication. And prior, there was one injectable that was being used. It's called Cartrophin. It's a really common medication. They have different mechanisms of action. They do different things. But, like, pretty much as soon as it was released, like, my vet, like, the patients that were on Cartrophin, like, he thought might benefit from Librela, and any patient afterwards that he was like, yeah, your dog has arthritis. I'm recommending this. That medication would always be recommended if it was good for your dog. Obviously, like, obviously there are medical contraindications, things like that with some medications, but I think it's just about your vet team knowing what's going on and trying to educate you on the things that could be the best for your pet. Because I think also in certain circumstances, like, it's like if you have a 6-month-old puppy, would you want an email about Librela coming out? Right?
You don't want to get a newsletter about something that you don't need, but then
relevant.
now you think you do because it's like, oh, well, you said that this, my dog,
or what about this?
Why don't you give my dog that?
Yeah.
Well, they don't need it. Well, how do you know? And so I guess too much information is also a bad thing.
Yeah.
So it's better to kind of keep that as a
just
pet
kind of
by
like
pet
a
basis.
like a, you know, this is, or even if you have a breed that's prone to something, like a giant breed that would be, you know, more prone to arthritis, you can always ask, you know, like, in the future, what are the things that are going on right now? And then at your next annual, is there any new progressions? Like, things like that. You can totally ask those questions. I think,
So it's just like case by case basis rather than
I think in my
widely
experience,
popular thing. Cool.
Yeah, that makes sense.
Yeah. Is there anything else you would like to ask?
I think we are good. Is there anything you want to add? Is there anything you want to share?
A little bit of another shameless plug here,
That's
but
fine.
my clinic that I work at right now has been in renovations for a little while.
Okay.
So we're actually just reopening in February, and it's going to be called something different. So
I mean, you can share what the clinic is called.
yeah.
that's
So
fine.
it was called Crescent Animal Clinic.
Okay.
It's going to be rebranded as Argovet.
Argovet, okay.
It's just on 16th by Peters.
Okay.
And it
it's
is
a fear-free clinic.
It's not a fear-free certified clinic.
Oh, okay.
Yeah, I'm the only certified
Right.
fear-free professional. But yeah, like I said, we use fear-free as much as we possibly can. It is owned by one vet. He grew up in Calgary. He actually went to my high school, like, quite a few years ahead of me.
Oh, you can give him a shout out too.
Shout out Alan Lung. He's
There we go,
the
Alan.
best. And yeah, we have a great, really, really, really fun team. So yeah, really excited about that. And having our patients back. It's been a little bit of a weird time off, not seeing our patients. So it's really exciting to be able to see
And
them
then
again.
you guys are going to be accepting new patients? when
Always
you're-
accepting new
I think
patients.
most vets are always
Yeah,
accepting
yeah,
new patients.
yeah.
So when you're doing your research and you're in the Calgary area,
Vets.
there you go.
Argovet, everyone, I will be there.
If you're not in Calgary area, just disregard that one.
Yeah,
You can
yeah.
look them up still, see what they're about. But
Yeah, give him thumbs up.
Yeah, but I also just wanted to say, thank you guys for having me on. It's
Yeah.
really
no,
fun.
it
I've
was
never
great.
done anything like this, obviously,
that's
but
awesome.
it's cool to know that people kind of want to hear from a TA. It's pretty.
Well, yeah, and that's the whole point of this show was to just educate dog parents. Like, we're not, as we mentioned on most of our shows, we're not professionals, we're not experts, but we want to find a way for people to share their knowledge and share their expertise.
Yeah. Just that there's options out there, and these are the options because a lot of people don't do their research, right? And it's so hard to find things nowadays on the internet. So having someone like yourself to share, you know, what dog parents can expect and things like that is very valuable. I think.
Excellent. Okay.
All right.
Well, that's
thank
it.
you so much.
Yeah, and don't forget to subscribe if you're watching this on YouTube, and follow it on Spotify or Apple Podcasts. So I've been on Shopify a lot lately, that's why. Or wherever you listen to this. And then if you got any sort of helpful information and you know someone else needs to know this, then be sure to share it with them as well. So.
And if you have any following questions for the vet techs,
Yeah.
you can drop them down below.
Yeah. And we'll email them all to her. No.
We're like, this is the list of questions we have for you. Answer.
All right. Thanks, everyone.
All right, thanks,
And
guys.
Thank you.
Okay.
Bye for now.
Bye.